Have you ever been to a physical therapist and felt like you were being gaslit? Like things were not being well explained to you, you left feeling disempowered, and you didn't feel like you got your questions answered or even understood what the plan was? You may have been trying to talk about the exercises and how they were making you feel, and you just felt like you were not heard or given any advice on what you should do next. Well, then today's video is for you. I'm Dr. Amy with Physical Therapy for Everybody, and I was recently watching a YouTube video by Dr. Kaveh, and he is an anesthesiologist in an operating room, obviously, who was talking about gaslighting in the medical profession. And specifically, he gave 4 really great tips on how to deal with gaslighting in the medical setting with regards to doctors. And I'm definitely going to recommend that you go watch that after you finish watching this video because I think it's really, really helpful. But I felt like what he explained was more geared towards the doctor, MD doctor, patient relationship as opposed to the PT, the physical therapist or doctor of physical therapy relationship. And so I felt like I needed to make a video to explain a little bit more from my perspective as a physical therapist of how you can see gaslighting and what you should feel like and how supported you should feel after you go to physical therapy appointments. Now, it's definitely different dealing with an MD doctor versus a PT doctor because often when you go to PT, you get to go more than once a week. You get to spend some time there. So we actually get a chance to talk to our patients and really understand what's going on with them, how this problem is affecting their lives and their families and all of those things, which is really fantastic. I mean, not that you're having problems that are affecting your lives and your families. That's not fantastic, but it's really fantastic because we get to solve some of the other problems that are coming along with this physical problem. And that's how the patient physical therapist relationship should be, in that we should have that opportunity because we get more time to talk. That's actually why I became a physical therapist as opposed to a medical doctor, because I wanted to have that time with my patients to really understand what was going on with them and how this was affecting them. True story. I'm not kidding you. I was going to medical school and I switched gears because I figured this out a long time ago. All right. So here's the thing though. I have heard way too many horror stories from patients who felt belittled by their physical therapist, who felt unheard by their physical therapist, or worse yet, they were just passed off from person to person. So they never felt like they could have a real communication, a real conversation about what was going on with them and how what was happening in the clinic was affecting them on their day-to-day life. So here's a couple things that I really want you to watch out for and that I encourage you to look for in your physical therapist. The first one is when you finish your initial evaluation, the first time you meet with a physical therapist, you should be left with a great deal of hope. They should have been able to explain what's going on and why it's going on and what they're going to need to do to help you to fix this problem and approximately how long it's going to take. Now, I understand everybody's different, and so some people really expect the problem to get better in 3 to 4 visits, and that may not be a reasonable expectation because if you've had this problem for 20 years, it might take a little bit longer than that. But again, your physical therapist should be able to have that conversation with you. And you should feel free to be able to ask questions on anything that you don't understand that's explained to you. So here at Physical Therapy for Everybody, we not only explain that to the patients, I actually write it down. So they actually get to walk home with a sheet of everything I said, and then they can go look things up, they can review it. And I always tell my patients at the end, after I've explained everything, I say, what questions do you have for me? And there's 2 types of patients. One has a ton of questions and, we may go out to the skeleton and look at that and talk about that. We may pull out an anatomy book because they want to understand more about what I'm saying to them, which is fantastic. The other group of patients has kind of a deer in the headlights look. They're kind of fogging over. This is a lot of information to absorb at once. They weren't quite necessarily expecting all of this and they don't have any questions, which is, again, absolutely fine. I always tell them, you can ask me questions at any point along the way. If there's ever anything now or later on that you don't understand why we're doing it, feel free to ask me because I'm more than happy to explain it to you. It's really important. This is your body. You're going to be in it for the rest of your life. You need to understand what's going on with it to the degree that you want to. Now, that's another thing. There are definitely some patients who are like, just fix me. I really don't want to know what's going on. And that's okay, as long as you're willing to do your part too, because, it's a partnership. So we both got to do our parts. And that's okay. If you don't have a lot of questions or you just don't want to know, you just want this problem fixed for you, that's totally fine. But either way, if you have a ton of questions or if you have no questions, if you want to help with this process, if you want this taken care of for you, you should feel very hopeful that you're on the right track and you will have the necessary assistance to get you where you want to go. That is super important. Now, the next thing that should happen is your physical therapist should be curious. So one of our core values here at Physical Therapy for Everybody is be curious and adventurous. And the reason why is because every body is different. And just because we expect something to happen after we did something in the clinic, or just because we expect something to happen after we give these patient exercises to do at home, it doesn't mean that that's what's going to happen with their body. So it's really important to be curious. So that came into really big play this week in the clinic. I had a patient come in. I've only seen him a couple of times so far, and he's had this problem for a long time. But he came in and the problem had totally flared back up, like 100%. And, he was frustrated and wondering, I think, if this is actually working for him. So I asked him, now he woke up with the problem on Saturday morning. So I asked him, okay, tell me about Friday. What did you do? And we talked about what was going on Friday. And I was like, well, it could be this and it could be that. And, I was just curious, like, let me think about how those things could have impacted you in regards to what I already know about your body. He didn't seem to really resonate with that because he didn't have any pain when he went to bed on Friday night. And I was like, that's a good point, right? If you didn't have any pain when you went to bed on Friday night, what happened on Saturday morning? He's got a good point. And I was like, okay, well, let me see what's going on, how your body feels. So when I was treating him, I noticed that there was something that was very, very different from what I had seen in previous weeks with this patient. So at the end of the treatment, I said, okay, I don't know why it happened, but here's what happened. And so I was explaining to him and showing him, demonstrating, showing him on myself what happened. And he said, oh, I know why that happened. And he told me exactly why it happened. And it was how he was scrunching up his pillow when he was sleeping at night. And I was like, well, that makes perfect sense because you didn't go to bed with pain, but you woke up with pain. It makes sense that something you did while you were sleeping was causing the problem. So now it's fabulous because we understand what caused this flare-up to happen. And now we can answer the question, and I'm getting to point number 3 here. We could answer the question of what he needs to do in regards to his pillow and sleeping. So he was trying to scrunch up his pillow to be more supportive of this curve in his neck. And that's what happened is he did too good of a job. It was a little bit too much, kind of pushed things the wrong way. And so we talked about, okay, I understand why you were trying to do that, and it makes sense. And I have no problem with you doing it. I just have a problem with the way that you did it this time, because obviously it flared everything up. We don't want to flare everything up. So I was like, here's what I need you to try for the next week. So we found a new question that we didn't know about before. And again, this is point number 3, is then we answered that question. I gave him an idea of something to try. Now, will it work for him? I don't know yet. But when he comes in next week, I'll say, okay, did you try that? How did that work for you? And if it did, fantastic. We've got an answer. If it didn't, okay, let's find another answer. Let's try this. Let's try that until we get to answering this question, because this particular question is definitely part of the problem that's allowed this problem that he has to go on for so long. Now, there's other things, but this is one piece of the puzzle. And I admit that dealing with how you're sleeping is not exactly what we do here in the clinic. We try to get things moving here in the clinic because we believe that movement is life. But we also need to talk about what you're doing the other 23 hours of the day that you're not in here, and the other days of the week that you're not in here. So you need to be able to have someone you can work with who inspires hope, who is curious about what's going on with your body to help you solve all of those problems and answer all of those questions. Because I very rarely, in fact, I can't think of anybody who I'm treating currently who only has one activity that they do that causes one problem or pain pattern. We're complex individuals, and it's more than that. So you need to find someone who's willing to walk alongside of you, who's willing to be curious along with you, to help get into the weeds sometimes to figure out the answers, because it's not just what we do in here. It's also what you do out on your own. And I don't mean that in a negative way or a belittling way, in saying that we need to work together to solve this whole problem, because we don't want this problem to be affecting you in the future. So how you're sleeping, how you're walking, the exercise you're doing, all of those things go into play into what's going on with you. And you need someone who can give you some solid advice and give you some ideas on things you need to change in order to change the result that you've had in the past. All right. Well, I hope this was helpful for you. If you feel like you've been gaslit, I hope this will give you some ideas on characteristics to look for in your next physical therapist. And I definitely hope that and would like to encourage you to ask questions. If you feel like you are not getting the answers you need from your physical therapist, ask questions. I always tell my patients, if I don't answer it the first time, ask the same question again. Because what that tells me is I didn't answer it in a way that they understood. I need to find a different way to answer it. And, sometimes it takes a little, maneuvering to figure out how to communicate, if we need to find a book or if I need to point to them or, there's different ways that people are able to take in content, but I want to make sure that they understand and that they get an answer to their question that is actionable and that they can use to take care of their bodies in the future. So, over to you. If you've been suffering from gaslighting in a medical setting, then what have you done that you have found helpful? Let's encourage other people. Let's share our ideas. If this content was valuable to you, I definitely would love for you to hit the subscribe button, because we post here regularly to try to help you get the best outcomes for your body. Have a great day, everyone.